Hello, I'm glad you could make it to this talk where we're going to be talking about compassion fatigue and how it affects front desk staff as well as others in vet practice. My name's Rosie Alistair and I'm manager of Vet Life Helpline. I've also been researching mental health in the veterinary industry for 13 years. So we're going to talk about what compassion fatigue is, what adversities do front desk staff face in particular that might contribute to compassion fatigue, and what helps. So what kinds of adversity do front desk staff face? When I talk about adversity, I mean situations that are difficult or challenging. There's pressure being the first point of contact in a veterinary practice, and not just pressure around creating that right first impression for your practice team. There's also pressure around being the first point of contact for all of the difficult things in veterinary practice. So being the one who picks up the phone to a very, very frightened or confused or desperate client in a horrible situation where their pet is very, very sick. Being the first point of contact when a client's come in and they're really angry or upset about money or other things. That can be really, really difficult. We also know that client behaviour can be very different with front desk staff than it can by the time they come in to see me as the vet. And by different, I don't mean better. So you often get the very, very challenging aspects of client behaviour in a way that vets don't always. By the time they come in to see me, I know sometimes clients that have been very agitated or a lot of conflict in the waiting room are completely different with me. And that's really important because sometimes that's because you've absorbed and dealt with in a very skillful way a lot of that tension and difficulty. Sometimes it's just because people behave differently with people in different roles. And I don't think in veterinary practice we acknowledge enough the amount of pressure that puts on front desk staff having to deal with difficult behaviour very, very frequently. Multiple competing demands, so having two phones ringing at the same time as well as a big queue of clients and a list of other things to do, and a vet and a nurse both wanting your help with something. A training responsibility mismatch. So sometimes we ask people in front desk roles to do things that we haven't always trained them for, and that isn't right. So these things might be things like bereavement support with very, very upset clients. It might be dealing with conflict, those kinds of things. Dealing with all the other staff's stress. Sometimes the front desk can be the place where people go when they need to talk about difficult things. You often end up absorbing everybody else's problems without having the right support yourself. Bereaved clients. Clients come in to collect ashes, those kinds of things. Really, really difficult times in terms of providing the right support. Distressing situations. So situations where you've got very, very sick animals, you've got very vulnerable clients, can be really, really hard situations in veterinary practice. Complex systems and changing ways of working. So this is a particular issue at the moment. The last few months during coronavirus, we've changed our ways of working in veterinary practice at least every couple of weeks, and they've been really big changes that normally we plan for and spend months adjusting for. So we've all had to do lots of change, and it's been a difficult time. There's also the issue of furlough, the difficulty of having been furloughed, the difficulty of not having been furloughed as well. Both situations are tough. The front desk role at the moment in making sure people have the right PPE if they enter the practice, or that clients stay outside if they're meant to, and just working in a risky situation in a pandemic. And lots of other things as well. So what is compassion fatigue and what is burnout? I'm going to mention both of those because they're related, and I'm going to mention some other things as well. In fact, I want to mention 5 terms that are often confused. Those are mental health, stress, burnout, moral injury, and compassion fatigue. Don't worry if you've not come across all of these before. I know you'll have come across some. We're going to chat through briefly what they are, and then we're going to focus in on 3: burnout, moral injury, and compassion fatigue. Those are pretty closely related in some ways, and they're very often confused in our industry, but it's different fixes for each of them, so it's important we know which one's which. So mental health, the World Health Organization definition is mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. We also know that there can be mental health problems where people become unwell, and it's really important in veterinary practice that we don't have stigma towards mental health problems, that we make sure that we support people who experience mental health problems. We all have a state of mental health at any one time, and it's really important that that help and support is there. Stress is the adverse reaction people have to excessive pressure or other types of demand placed on them. So stress is affected by how difficult something is, the level of demand, how much say you have about it, the amount of control that you have, and the support that you have to deal with it. And that might be things like resources, like having the right computer system or one that works, having the right amount of staff to answer all of the phone calls that come in the day, those kinds of things. Moral injury is particularly important at the moment, I would say, during COVID in vet practice, when we've got changing ways of working. So moral injury is harm from having to act against what you know you need to do or what you think it's right to do. So this might be even providing a different type of service to what we normally provide. If you think what we normally provide is the best level of client interaction and communication, and now we're having to deal with upset clients in the car park and those kinds of things, that can be really difficult for us as providers in terms of feeling that we're not doing what we're used to doing by somebody and we want to help them. Burnout is a type of chronic stress leading to physical and emotional exhaustion, cynicism and detachment, and being ineffective and having a lack of accomplishment. Now, burnout is very rarely an individual issue, and that's important because if one person in the practice is burnt out, it's likely others will be too. It also happens over time, so it's things adding up and building up. Compassion fatigue, which we're talking about today, is different. It can involve an element of burnout, and burnout can be a factor that helps to lead to compassion fatigue, but it also involves something called secondary traumatic stress, which is when you're exposed to the suffering of somebody or something else. It can be cumulative, so it can add up, or it can be just one incident, so it can be more rapid onset than burnout. So it's vital that we have the right support as people who are supporters in our jobs. I wanted to talk in more detail about moral distress, burnout, and then go on to talk in detail about compassion fatigue. So moral distress arises when one knows the right thing to do, but institutional constraints, so that might be your practice policies, it might be the resources available, it might be your boss, it might be your other colleagues, make it nearly impossible to pursue what feels like the right course of action. So moral distress happens when you know the right thing to do, but you're constrained. It comes in two phases: initial distress at the time and later distress when you think about it later on. And it involves the compromise of your values, of what you think it's right to do. Now, I don't know if you're recognising situations where you felt this in practice, but I've certainly experienced it in different roles in veterinary practices. Now, burnout is a syndrome or workplace phenomena. So burnout isn't like an individual mental health diagnosis. It's described as a workplace phenomena, and it's due to chronic workplace stress which has not been successfully managed. So as I said already, this isn't an individual level problem. The practice need to be paying attention to burnout so that they can sort it out in terms of the factors that have led to it. It occurs when an individual can't achieve your goals and results in frustration, a loss of control, increased efforts, and diminishing morale. There's been a lot of studies that have looked at burnout in the veterinary team. Most of them have focused on vets or clinical staff. However, some have looked at the whole team, not enough. This Canadian study looked at the whole team, and it found, unsurprisingly, that all team members, not just vets, are at risk of burnout. That might seem a bit obvious to people in your role, but it's really important we have this kind of research so that the industry pays attention to the stresses and the difficulties in other roles in veterinary practice. The study found that job satisfaction was generally good in veterinary practices, but coordinated team environments were really important to help to reduce burnout and prevent burnout. Feeling that you're making a team effort, recognition of individual contributions, and making sure that team environments aren't toxic. Burnout is related to compassion fatigue. And I've also got a new term here, compassion satisfaction, that we're going to go on to speak about. So compassion fatigue can be a combination of something called secondary traumatic stress and burnout. So secondary traumatic stress arises from a rescue caretaking response, and that means when you're trying to help and you want to help, and occurs when we can't help. So sometimes there are situations in veterinary practice, and I'm sure you're getting about lots of these, where we can't rescue or save people or animals from harm. And that can result in guilt and distress for us. Not always, but sometimes. And there can be lots of different factors that impact how it affects us. Compassion satisfaction is important because secondary traumatic stress and burnout added together can sometimes lead to compassion fatigue. But if compassion satisfaction is there as well, when you add secondary traumatic stress and burnout, compassion fatigue doesn't always happen. So compassion fatigue and compassion satisfaction can be seen as positive and negative consequences of working with individuals who've experienced or currently experiencing trauma or suffering. So compassion satisfaction is that feeling when you can help, when you're doing something useful, parts of your job that make you feel better. We're going to go on to think about what those might be. So as I've said, burnout plus secondary traumatic stress can mean, not in all cases, but can mean compassion fatigue. Burnout, secondary traumatic stress, when there's also compassion satisfaction, so when you've also got things in your job that are helping you, that make you feel better about what you do, that make you feel you're being effective, doesn't always mean compassion fatigue. So compassion fatigue, as we've mentioned, is stress resulting from exposure to a traumatized individual. And that might be a client who's suffering, it might be an animal who's suffering a lot as well. It's often an extreme state of tension and preoccupation with the emotional pain or physical distress of those needing help. And it can create a secondary traumatic stress for us. Signs of compassion fatigue can be exhaustion, anger and feeling irritable, negative coping behaviours, including harmful alcohol and drug use, reduced ability to feel sympathy and empathy, diminished sense of enjoyment or satisfaction with work, increased absenteeism, impaired ability to make decisions, finding it hard to concentrate and care for patients or clients, and intrusive thoughts, often memories, as well trying to avoid things that remind you of the difficult time. So if it's been a difficult time around returning ashes, for example, with an incredibly distressed client, then it might be that you try and avoid that task in the future. Again, we don't have enough good evidence for other practice staff. There isn't a lot of research on compassion fatigue, even despite how common it may be in veterinary practice. There is some evidence around staff who aren't vets in practices, and this is from the United States. This focuses mostly on veterinary technicians, which is a role that's similar to veterinary nurses, and assistants in veterinary practice. So not specifically front desk staff, but some of it relates, so we're going to have a little talk about it. So about 50% of vet techs and assistants were found to be at moderate or high risk for compassion fatigue, and burnout was relatively low. Stressors included difficult clients, problems with co-workers, and not having enough time to do their job well. Compassion satisfaction, so the stuff that can be protective, was strongly related to helping care. So the stressors: dangerous animals, losing a patient, not having the right level of trained staff, disputes with supervisor, high-risk patients, so this is particularly an issue for people in nursing roles where they're dealing with patients that are very, very sick. Euthanasia, not enough time to do the job well, problems with co-workers and difficult clients. I'm sure you'll recognise some of those from your own experience as well. What were the sources of satisfaction? Getting to educate clients, daily contact with animals, using skills and learning new ones, so developing in your role, thankful clients, working as a team, and feeling that you're helping or healing animals as part of that team. There's other factors that affect workplace wellbeing too, and these can be things like physical risk, which is something that we don't talk about enough in veterinary practice, and I know can be an issue for front desk staff too, both from clients and from animals. Role models, we often end up role modelling on other people in our industry, and how that can sometimes affect our well-being too, especially if we're role modelling our work on someone who doesn't have very good well-being themselves, perhaps because their work-life balance is out of sync. Psychological safety and trust. So psychological safety is the belief that you won't be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. It's so important in an environment like a veterinary practice where there's a lot of safety critical activity that we have psychological safety. Also support, the right support in your practice, and the culture of your practice and of our industry. So when I talk about support, I'm thinking about two types. Horizontal support is your peers, colleagues, having buddy check-ins, the rest of your team, your friends and family as well. Vertical support is the leadership team, your line manager, mentors, supervisors. Your immediate line manager is an incredibly important person in helping to determine your mental health and your well-being at work. Really key person. So I'm going to finish off by thinking about what helps. And I've got 20 things that help. There's lots of things that can help with well-being at work, with compassion fatigue. And I've split these into 3 areas. The first is, what does a good manager for mental health look like? This isn't all about you as an individual having to fix things. It's actually about having the right environment, the right people, the right support in your practice too. It's really important. So a good manager for mental health listens, is supportive, and knows what to do if they see a problem. They don't criticise staff in front of others or make other people look bad. That's really important. So how they deal with things when there's difficult times or when there's something that's not gone well is really key. They also don't take on all of the work themselves, and this can be a common problem in the veterinary industry, but it's really important that a good line manager isn't doing that. They're looking out for safety, for your safety, the safety of other staff in the practice, safety of clients and patients, and they're also communicating well. The next part of our 20 things are 5 things that can help with compassion fatigue. So we talked about compassion satisfaction, those things that make you feel good about your job, that make you feel that you're doing something rewarding and that helps you. I'd like you to think after this talk about 3 things about your work that give you compassion satisfaction. So give you a little bit of a protective effect at those difficult times, make you feel that your work is meaningful, that you're doing something useful. It might be thankful clients, it might be opportunities to educate clients about issues, it might be providing support to other people in the practice, it might be a whole range of different things. Reducing burnout is important in helping to prevent compassion fatigue. And what helps reduce burnout is coordinated teams, good communication as a team, recognition, helping people to feel effective. It's important that we feel effective most of the time in our work to help us stop being burnt out. Managing stress is important too, about prevention, not just reacting when things are stressful. And again, this is about practice level stuff. So it's stress risk assessments, proper stress management at work, workplace prevention of stress, working conditions, making sure that your job is possible in the hours that you are contracted to do it. So not having a job that's impossible from the very start. Self-care as well, and encouraging self-care at work and not having a culture of, well, we don't take breaks, because those kinds of things are really important. Job satisfaction is important too, and that's related to things like pay, holidays, good working atmosphere. It's also important to have opportunities for recovery and good peer support after difficult incidents. So we've talked about how compassion fatigue can be partly related just to one or a few more incidents that have been really, really difficult. And I'm sure you can think about times in veterinary practice where there have been incidents that are really hard and that do stay with you. It's important when we have incidents like that we have really good peer support and we have time, that if you need a break, that you get one, that you have time and space to talk about that with peers, and that you're supported in those situations. So what helps in terms of building well-being at work? There's a lot of things that can help. Team camaraderie is really important, and this is particularly important at the moment when teams have been through a lot of change over the last few months. Some people have been furloughed, some people have not been furloughed, and both of those situations can be really, really difficult for people, and it can make things difficult in the team too. So that sense that we work together, we're pulling together for the same thing, and we're here for each other, we've got each other's backs. That's really important for team camaraderie and for your well-being at work. We've talked about the horizontal, peers, and vertical management support. Rotating off the most intense tasks. So this, I think, is particularly important for people in really frontline roles like yours, when you're working at the front desk, when you're dealing with clients all the time. There's one aspect of work that's particularly intense, whether it's the phones, whether it's being on the front desk at particular times, whether it's dealing with clients who've just been bereaved. Make sure that if you've got a team, that people are sharing aspects of work in terms of if someone's having a really, really difficult day on the front desk, making sure that they get support to do some other aspects of their job if that's possible, or if that's not possible, that they get a proper break. Breaks and rest are really, really important. Sometimes in veterinary practice we're not good at taking these, but they are really crucial for helping to look after our well-being. I see breaks as a safety issue. They're that important. Support to build skills. So there's a massive range of skills, as you know, that are needed for front desk work. Things like bereavement support, really important. Conflict de-escalation, knowing how to respond when clients are coming in a state where there's potential for conflict. So helping to de-escalate, and that's everything from knowing how to listen, knowing how to diffuse situations, knowing how to help clients feel heard, body language, all those kinds of things, knowing what to do if things are going wrong. Having the right resources and equipment to feel safe at work. So this can be looking at systems. So I said this isn't all about you as an individual, and it absolutely isn't. A lot of this is about having the right safe systems at work. Taking control. So understanding what you can and cannot control in workplace well-being, understanding what is and isn't your responsibility. Often in vet practice we have quite fluid roles, and we do a lot of lateral thinking, and we're picking up different tasks that may or may not be part of our role. But it's really important that we have a defined sense of what is and isn't our responsibility, and what things we can and cannot make a difference to as well, and that we don't take away guilt when we're not able to fix absolutely everything. Prioritising well-being and thinking about the evidence base for what helps the most. So things like the 5 ways to well-being can be really important here. Those are connect, keep learning, take notice, be active, and give. And you can find out more about those if you search 5 ways for well-being, or we can talk about those another time. Sleep is really important. There's lots of increasing evidence around the role of sleep in psychological well-being. Can be difficult at difficult times like the moment during the coronavirus pandemic. It's a global health emergency, and it's really, really difficult for lots of us at the moment for lots of different reasons to get the right amount of sleep, and that can affect us. So doing things that maximise and your sleep can be really important, and again that's something we can talk about another time. We've also mentioned psychological safety at work, that feeling that you could ask a question that feels like it's a stupid question and no one's going to judge you, that feeling that if something goes wrong you're not going to be unfairly criticised, that people are going to have your back, that feeling that you're not about waiting to be blamed for something, that isn't the kind of thing that happens where you work, that you know that your colleagues are going to be fair, they have integrity, and they're all going to look after each other. That's so important in helping you to have good well-being at work, and helping you to deal with compassion fatigue, and also to help to prevent it. There's also Vet Life Helpline, and I wanted to speak about this, obviously being from Vet Life myself. A lot of people don't know that Vet Life Helpline is there for everybody in the veterinary community. We do get calls from front desk staff and other people working in veterinary practices who aren't veterinary nurses or vets, but we don't get enough calls for how difficult we know those roles are. So I'll tell you a little bit about Vet Life Helpline. VetLife is an independent charity and we provide support for the veterinary community. So if you're working in a veterinary practice or the veterinary industry, we're absolutely here for you. Our helpline is 24 hours a day, 7 days a week, every single day of the year. And you can call us on 0303 040 2551. If you do one thing after this talk, add that number into your phone. The reason I say to do this is not just that you might need to call yourself, but also you might want to give it to somebody in your practice who's struggling, so add it into your phone now. You can also email us, and the email is via our website. And the reason the email is via the website, not to a particular email address, is because when you go onto our website, there's a button to click if you want to email, and it takes you through to a page where you register a completely anonymous, made-up name, and you enter a password. And the reason for that is so that we can't actually trace your email address. So the volunteers who respond to you don't actually see your email address at all. They just see the name that you've made up to use with us. So if you want to call yourself Batman when you contact us, it's absolutely fine, you can do. We know sometimes that talking about things in the veterinary industry can be hard, and so we want people to feel that it's a completely confidential and safe space to talk. The people who respond to calls and emails are trained volunteers with experience of the veterinary industry, and those volunteers get a lot of ongoing training and supervision. If you're interested in becoming a volunteer for VetLife Helpline, you can look at our website and do get in touch. Front desk staff are absolutely welcomed to become volunteers, and it's really important that amongst our group of volunteers we have really good knowledge of the different roles in the veterinary industry. So in summary, it's all right to not be okay. It is okay to not be okay. And sometimes it can feel very hard to really believe that in our industry, but it's important that when things are hard, we pull together, we look after each other, and we can reach out for help. Things in our work that give us meaning and fulfillment are really important. So identify those 3 things in your work that give you compassion, satisfaction, and look out for those. So make sure that you're getting those in your work, and include that in your plans when you're doing development plans and stuff at work. The things that help you to feel that there's meaning and fulfillment in your job. Rest, recovery and support are really important too. Identify who is on your support bench. So that might be friends and family, it might be some colleagues at work, it might be line manager as well. Know who it is who, when things get difficult, are going to be the people that you go to. And we're here if you want to talk as well. You can contact VetLife anytime. If you want to find out more about what we do, please have a look at our website, which is www.vetlife.org.uk. Thank you.